I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello and welcome to this episode of IDD Health Matters. Our guest today is Adam Chittam. Welcome, Adam.
Thank you very much for having me.
All right, so Adam, we are at the Developmental Disabilities Nurses Conference in Baltimore, Maryland. And you're here as a vendor with an organization called Tarrytown, right?
That's correct.
All right, let's talk about it. Tell me what you do in this field and just a little about yourself.
Perfect. So a little bit about me is I'm a pharmacist. So graduated back in 2009. So I've been a pharmacist going on, a little over 16 years now. Been in IDD specific pharmacy for about 8 years. So I did a little bit of the retail thing and then slowly but surely fell into long-term care. And realized after I was doing it for a few months that it was a very specific long-term care, originally from South Carolina. So we were serving only the IDD population in South Carolina, mainly DDSN, developmental disabilities or developmental special needs boards.
Okay.
So we then, after serving them, was lucky enough that as our company was growing, Tarrytown came in, Tarrytown XPO Care Pharmacy, and they purchased us, and that's where this leads us now, is part of Tarrytown XPO Care Pharmacy. We are a national long-term care pharmacy, but what is unique about us is we only serve the IDD population.
Okay, so tell me about pharmacy in the IDD population and why is it unique?
Perfect. So pharmacy in the IDD population is unique for a few different reasons. Our population, our individuals, are usually on meds that would not be as common in the general population or that you would find people getting at regular retail pharmacies a lot. So there's a great need for specificity, and our folks a lot of times can end up on that popular word of a polypharmacy type situation.
Yep.
So it's very good that since we are laser focused on only one population, we have some good clinical pharmacists on staff, but even our regular staff pharmacists have additional training and knowledge of the population. So it's nice to have a service that is specialized for a specialized group of folks.
So let's go back to polypharmacy. Could you tell us what that is so we're all on the same page here and some of the difficulties and challenges that arise from people that are on lots of meds?
Certainly. So polypharmacy by definition is most of the time when anyone is on 8 or more medications.
It's a lot of meds.
It is. 8 is a lot. The average for the general population is usually potentially about 4 medications. The average in our population can be anywhere from 13 to 15 medications.
Wow.
The stat that goes really conveniently with that is once you get 8 medications or above, you have a 100% chance of a drug-drug interaction.
You don't hear a lot of things that are 100%. Unfortunately, It's having drug-drug interactions in this case, but that's a number worth noting. And so what we're talking about here is the more medicines you add, well, one medicine affects a different medicine, and that one affects something else, and then you get side effects that compound on top of each other, and then basically is what it is, and you can see the difficulty and the challenges in what that might, or how that might appear, right?
Most certainly,
Yeah.
most certainly.
Yeah.
It turns into a balancing act, right? And what we try to avoid is, and it sometimes is unavoidable, is sometimes some of those higher up number medications end up getting added specifically to sometimes treat side effects that are unwanted but are unavoidable of necessary medications to have the quality of life someone needs and deserves. So it's a balancing act, right?
So why do you think people with intellectual and developmental disabilities are typically on more medications?
So depending on certain diagnoses and the disability itself, there's a lot of times medications that need to be on. A lot of times you would think certain things for mood, those type things. And the real fun piece of it is that those generally required medications all lead towards lowering something we call the seizure threshold. So then, as you can imagine, if you lower that, now we're at a need of adding certain anti-epileptic medications, which all have their own side effect profiles and these type things. So, and our population also, regular people just like you and I, they have the same things. We're going to get older. We're going to need blood pressure meds, cholesterol meds, those type things as well.
So some of it's kind of the regular stuff that happens to everybody, but we know that people with intellectual and developmental disabilities have a higher incidence of seizures, for instance. So many times they'll be on one or two or sometimes more seizure medicines, because not only are there more seizures, and we see people, more people with seizures that have intellectual and developmental disabilities, they're also more complex and more challenging to treat. So you many times may need more than one medicine or have multiple interventions. And then you've got side effects, as we said, and interactions. And we know that sometimes, and I have to kind of, toot this horn a little bit, there are a lot of behavior meds that are used, and these are typically antipsychotic medications, which have their own sets of complexities and side effects. And I would have to say that sometimes those medications maybe aren't needed, or maybe not as much of them or as many of them are needed, when we know, when we recognize that there are many different causes for behavior besides just that the person has a disability, then we're going to look for those causes and maybe avoid people being on some sort of behavior medicine when they actually had a treatable underlying cause. So that's something that I talk about a lot, and I bet as in the pharmacy world, you probably see those things as well.
Certainly. Yeah. It's something most people would think a pharmacist or a pharmacy, we want you to take as many meds as possible, when actually it's the exact opposite. And it is. It's sometimes, especially in our population, you mentioned it a lot, you've talked about it a lot, is when there's a known out there, people want to jump to that for the reason. When one example is, I was working with a provider we worked with not long ago, and had an individual that was having behaviors who normally would not, was nonverbal. And the thought was getting ready to start trying to shift around certain doses of antipsychotic medications, mood stabilizers, when all it took was a little more thinking that we just had a massive pollen drop. And let's see, maybe there's some seasonal allergies, and lo and behold, about a week and a half worth of Flonase, and behavior stopped and everything returned. It was because they couldn't verbalize.
And that is a perfect example of what we see so often is what we call diagnostic overshadowing, where we attribute a person's behavior to their disability and say, oh, well, that people with disabilities sometimes hit their heads or bite their arms or whatever it is. Without thinking, well, maybe, allergies are really acting up and they're having a headache or some sinus pressure or turn into a sinus infection. Why don't we think about those things first before throwing someone on one or two or three antipsychotic medicines?
Exactly.
Yes, and I can't stress that enough. So I think that is a big contributing factor to polypharmacy in people with IDD. We know that there are many benefits to medications. They can be very helpful. But we have to really determine, does somebody really need that medication? And to me, that really has a lot to do with educating people who work in this field to recognize all of the different potential reasons for behaviors, right? And to know that behavior is a form of communication. So what are they communicating? And in this case, they were communicating that they had allergies, something as simple as that.
Exactly, and couldn't say it. And was hitting, and it was really from sinus pressure was the main thing that was needing to be relieved.
So, many of us think about pharmacists as just people who you go to the pharmacist to get your meds. But pharmacists can do a whole lot more than that, and do a lot more than that in terms of consultation and helping people understand things. And in this field, it seems particularly valuable and important to have a pharmacist involved in looking at all of these medicines.
Most certainly. Unique with us at Tarrytown, again, laser focus, this is all that we do. So there's actually an extra layer of pharmacist check that go through each one of our meds. The traditional, make sure it's put in the system correctly. And then there's another layer where in a clinical department reviews each order just to make sure it checks all the clinical boxes. Our folks take medications that you in a regular practice would throw up some red flags to people on doses and things, but they've been on these things for a very long time. So definitely that same concept of also educating, and that's where we come in a lot. One thing I'm very privileged to be with part of Tarrytown is on the development and education team. So we do a lot of continuing education for our field, for our nurses in the field, and it's for that same process of the thought of, is this the right med? is maybe a med in the same class that is dosed once a day going to get you a better outcome just due to the fact that we're not going to have as many missed doses. So
that's fantastic and extremely valuable work, and something even I didn't appreciate when I began working in this field in the early 90s. I didn't think about the pharmacist actually, being part of that clinical team and helping me prescribe medicines better as a physician. So it's a great and needed and essential part of the team. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things I like to do is ask, 3 tips, 3 words of wisdom, 3 things that you think people should know that could help improve the world of supports and services or health and wellness for people with IDD. And I'm going to ask you specifically to talk about maybe 3 pharmacy-related things, medication-related things,
okay.
If you've got those. So what advice, words of wisdom would you give to people out there who maybe work in this field or have family members that are on lots of medicines? What could they look for? What could they do to make sure that the person's getting the most benefit with the least risk?
Okay, so I think I'll cheat a little bit and say my 3 would probably almost be education, education, education.
I'm with you there.
Right?
I think that's hugely important.
But it is. It's honestly not realizing until I've been doing this longer and longer how much some of the things that I know that aren't even pharmacy specific that I take for granted are not common knowledge in the public. So definitely with the folks that provide services, there are things that in doing this, very simple educational tools and constant training that can help in day-to-day life of providing services for the individual and for the individual themselves. Some of leaning into education would be we do some courses that are very clinically in-depth, and then we do some that are very great for DSPs that are just, it helps to teach common side effects of common OTCs and basic meds that folks are on.
So can I translate that into saying, one thing would be know the side effects of medications in people that you're supporting. Mm-hmm. So, get some information, talk to the pharmacist, maybe, look something up. I'd probably recommend talking to the pharmacist because when you look things up, there's a billion side effects to a lot of medications, and they can be pretty scary. But we know that many of those are minor or very rare. But it's the big side effects that we should know as supporters. And I'm going to add to that as know how it might appear differently in someone, for instance, who doesn't use words to communicate. So let's say, I don't know if I'm stealing your thunder, and I don't mean to, but let's say that a person starts on an antibiotic for an infection, and then they start becoming aggressive around meal times, and they start throwing their food. What we need to recognize from a supporter standpoint is that could mean that maybe that medication is causing nausea or causing their stomach to be upset, so they don't want to eat anymore, and they can't tell you that, so it comes across as aggressive behavior.
Exactly.
Okay, good.
Yeah, that's a great one. I mean, that could simply be from an antibiotic you said that's rough on the stomach.
Yeah.
That needs to be taken with food, but that can commonly maybe cause a little diarrhea or nausea. Yeah. It's perfectly logical that someone would say, every time I've eaten for the last couple of days, right? So I do not want to eat, and I will do what I need to do to not.
Yep.
Right.
Yep. Okay, so I kind of stole your thunder on that one.
No, I like it.
What other tips do you have?
So, and the caveat to the first would be when we mention side effects, you mentioned something very good, which is when you research on your own, side effect profile is usually massive. Yeah. So it's using the resource and education to know the main ones, like you said. I mean, and common things like someone takes Benadryl, they're going to seem a little lethargic more times than not. Or even knowing that every now and again it can do the opposite, right? So those, I would say, so the side effects, another one from the medication standpoint, from a pharmacy standpoint, is structure and consistency of being able to administer meds properly. So we do a great job of it, but in general, in this field, everyone should be using a pharmacy that has compliance packaging, that has some tips and tricks to help make sure folks are set up to be able to administer the right med at the right time to the right person.
When you say compliance packaging, what does that mean?
So like either maybe instead of, we're all used to getting meds in a bottle.
Yeah.
So this would be what we call a bingo card or like a blister card,
Gotcha.
where things are single dosed and they're numbered. And the labeling is still at the top and very easy to read, but it probably has time of administration, maybe even color coded. And that is one thing that we find as much as anything is it's very easy to start adding all kinds of meds and things when you assume someone is taking the medication they're already on properly. And it might be that they're not, so now you're adding additional medications that aren't even needed. So setting up anyone in the care process to be able to administer the right med. It sounds simple, but it's sometimes when there's a lot going on at a home, it can be very distracting. So,
Okay, so timing, accuracy of dosing, making it easy, finding the easiest way to do it.
Mm-hmm.
So, how about a third? You have a third.
Let's see.
Third
So,
thing?
and I would wrap the second one back up to just say consistency. Right? Consistency is the way to go. The third for me would be, let's see, that could improve and make. I think, again, I want to say education, but not from just getting the word out. And not specifically education, but it's so eye-opening to get involved with the population and just see how fantastic it is to work with these folks. I love it more than anything because I've never met a happier group of people in my entire life.
Yep.
So
it's a very rewarding place to work, which does lead into one of the things I like. One of the reasons I do this is so people can recognize this field as a wonderful place to have a great career that's rewarding in many different ways.
Certainly.
Yeah.
Certainly.
So, well, Adam, thank you so much for sharing your thoughts and your words of wisdom and for the incredible work that you do in supporting people with intellectual and developmental disabilities.
Greatly appreciate you having me.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.